I was lucky enough to be chosen as a Quilligan Scholar when I was merely a resident. The people that I met through that program became profound mentors for me and helped guide my career to where it is today.
Why did we need to start a foundation? Research is a much smaller, weaker leg, and training for research is even less well developed. To fix that, we needed a foundation in maternal fetal medicine.
There was a recognized need to train physician scientists. That is still our primary obligation today, although we have added many more programs since its inception.
We are able to provide mentoring, create an intellectual community that stimulates people to think in a unique way and to identify the right questions that can be translated to better patient care.
She was interested in education, she was interested in ultrasound training, and so she decided to help the Ghanaians start a fellowship in maternal fetal medicine.
I performed a needs assessment of 𝗪𝗧𝗡𝗡𝗘𝗖𝗧 Teaching Hospital as well as Comfort Noche Teaching Hospital in Kumasi. And after that needs assessment, I completed the curriculum. It has been approved and they've accepted their first fellow in Kumasi and soon to accept their first fellow in 𝗪𝗧𝗡𝗪𝗡 Teaching Hospital in Accra.
Bill's been my mentor since I was an intern in residency, so it's been 11 years. He always introduced me, explain my research, and it really opens doors and establishes collaborators, other mentors, so I think they're a good advocate as well as a mentor. The SMFM Bridge Funding Award came actually at a really critical part of my career when I was transitioning from being on a training grant to trying to become an independent investigator. So it gave me the opportunity to generate some pilot data looking at kind of mechanistically why women with depression become depressed during and after pregnancy.
She's taught me a tremendous amount and she's pushing a field forward that's incredibly important and has previously been underappreciated.
These scholars will improve the maternal mortality in this country and worldwide because of the great studies that they're learning how to do and improving that as a result of their relationships with the giants in the field today. Tomorrow, they will be the giants.
My message to those who funded and supported the Quilligan Scholars program would be very simple. It would be a very sincere and heartfelt thank you. It's hard to imagine taking money and time and energy away from yourself and your career to give to someone else, and it made me feel an obligation to give back to both society and its junior members in the way that people took a blind chance on me.
Without the Queenan Fellowships, we wouldn't be able to have the face to the global world that we have as an SMFM.
And I would lastly just like to say thank you on behalf of the women who are affected by these fellowships. There are changes being made in maternal and fetal health as we speak, and that impact has been great.
More than 20% of the membership give to the foundation, and that is substantially more than any other medical society that we're aware of. So I think it speaks to the warmth that our members have for the foundation and its programs and for the society.
Can't emphasize enough how wonderful it is to donate to the foundation. It is just really an opportunity to advance science, advance the careers of young people.
A small contribution can really lead to long-lasting impacts, both scientifically and on someone's careers.
You have filled me with qualities that I otherwise would not have received from anyone else, so thank you.